Hello student, myself Nanishore Vishwanath Dhole, lecturer from SBNM College of Deep Pharmacy, Mahad. Today's given topic name Absorption, Distribution, Metabolism and Elimination of Drug. These are the learning outcome from this topic. The learner will able learn the process of absorption and absorption mechanism. They also learn the factor affecting the absorption and distribution of drug throughout the body. Also, they learn the elimination of drug occur throughout the body. Let's see the introduction of. We first see here the definition of absorption. Entry of dissolved drug molecule into blood flow is called as absorption, or movement of drug from its site of administration to the central compartment and extent to which it occurs. Absorption occurs from common route as follows, such as enteral route, in that oral, sublingual, buccal and enamel route. Next, that was route parenteral route, in that include injectable and inhalational route. Next was topical route. This was the reflected question for student. How is the absorption occurs in our body? Pause the video, think on. Let's be I will explain this question's answer. These are the solid dosage form. Dosage forms are available as various form. It will be solid, liquid or semi-solid form. But here we take in the solid dosage form. It will be taken by the oral route. Then this dosage form goes through the GI tract. GIT tract, it will be absorbed in a bloodstream. Then it transport to the site of action or targeted tissue. The total amount of administered drug does not reaches at site of action, but only a fraction of dose is effectively absorbed. In order to produce desired effect, a drug must achieve adequate concentration at its site of action. So, one must have complete knowledge of the fraction of a drug dose that reaches the site of action after being effectively absorbed. This term called as bioavailability. Next, that was the process of absorption. We deeply study on that the process of absorption. Most of drugs are absorbed passively diffusion process. Few of active agents are absorbed active transport or carrier mediated transport mechanism. There should be the 90% of drug are absorbed by passive diffusion. The process can be summarized as passive transport mechanism or active transport mechanism. Let's see the absorption mechanism. Here is the animated absorption mechanism. In video, there was the barrier, lipid bilayer membrane or protein channel that which Passive transport or simple diffusion occurs, in which drug molecule or non-ionic substance without involvement of energy of drug molecule diffuse lipid membrane. This called simple diffusion. This mainly lipid soluble drug can achieve. Ionic drug or molecule. This is ionic drug or molecule. These ionic drugs are water soluble mostly. They are cross the membrane through the channel mediated. So transfer or tar it will be transferred through the channel. This absorption called totally passive transport mechanism. There should be no need of or involvement of not involvement of energy. It is called a passive transport mechanism. Next process of absorption is the active transport mechanism, in that the involvement of energy required to transfer ion molecule. The carrier protein, that is the carrier protein, help the transporting molecule. This is the transporting molecule which binds the carrier protein through the biological membrane and reaches the targeted organ. It's called a active transport mechanism. Here is the see the red molecule attach the protein carrier, and then it will be passed through the carrier mediated process. Let's see then, it's totally called active transport mechanism. Next, that was the concentration gradient process. In this process, a bidirectional movement of the concerning molecule depend on the concentration gradient without involvement of energy. This process is not dependent on pH medium, provided the drug dissolves in the intestinal fluid and reaches the absorptive surfaces. It's called as concentration gradient. Let's see the passive transport mechanism. This is the most common mechanism by which most of drugs are transported across the cell membrane. Non-ionic molecules are diffused through the biological membrane. This passive transport mechanism are major process of for absorption of 90% of drug occurs. This process driving force, concentration or electrochemical gradient are occur. It process follows the Fick's first law. What is Fick's first law? Drug molecule diffuse from region of higher concentration to the lower concentration until equilibrium is attained, and that the rate of diffusion is directly proportional to the concentration gradient across the membrane. It's called a Fick's law. Drug molecule or ion from higher concentration, their low concentration. It was the Fick's first law. It's depend on concentration gradient. We also see that the lipid soluble drug across the cell by passive diffusion without involvement of energy. This is not dependent on pH medium. Let's see the active transport mechanism. In this process, the drug are actively absorbed against the concentration gradient. Involvement of energy required. The drug attach a special carrier in the membrane, which is facilitate diffuse across membrane and release the drug. Last in animated video, we see there the active transport mechanism, in that the protein carrier substance membrane that which attach the drug molecule and facilitated across the membrane Inorganic ion like sodium, potassium chloride, calcium are absorbed by active transport mechanism. Thank you. Next video we see the factor affecting absorption. Thank you.